Hello, I'm Dr. Richard Levin. I was asked to give a talk today about men's health, and we've actually labeled the talk Men's Health and Beyond. So first we'll start off with, don't need the mask anymore. I'm vaccinated and the pandemic is winding down, so great. I'm a urologist in Aventura. If any of you need to look me up, you can at richardlevinmd.com. You may also find some useful information there related to what we're talking about. So I'm a board certified fellowship trained urologist. I have extensive surgical and non-operative experience, and I'm on staff at Aventura Hospital, who asked me to come here for the talk, as well as many other hospitals. I'm on the executive committee of Aventura Hospital, and I'm consulted for ethics reviews, and I'm chair of the infection prevention committee. I'm an active surgeon there and among the most experienced kidney stone surgeons in the country. Also, I was asked to join the American Board of Urology Imaging and Technology Committee and provide education and guidance for urologists across the country. So that's enough about me. That's my background, and my office is obviously in Aventura near the hospital. So what is men's health? Of course, it's general health, but there are unique traits and issues that men will encounter. And of course, there is prostate cancer. Prostate cancer is spoken about so much, I think we'll put it aside for this talk. There are some more simple things, though, that affect quality of life and not just length of life. We deal with kidney stones, BPH, which results in a slow urinary stream. We deal with erection issues and other sexual health issues. And less commonly known, we also deal with andropause, which sounds a lot like menopause because it is very similar. So in the interest of time, let's first limit the talk to today's last three: BPH, erectile dysfunction, and andropause, or low testosterone. They're all so very closely related. BPH is a benign, simple growth of the prostate. The prostate sits between the bladder and the penis, and then it becomes like a water faucet slowing down the stream. It also causes irritable symptoms like urgency and frequency. It's not usually dangerous, although it can sometimes lead to problems that are annoying, like urinary retention, urinary infections, or bleeding. Treatments with oral medications come with side effects like dizziness and low libido. So there's been a lot of effort of late looking for minimally invasive options to help get people off medications. Also, there have been some recent reports raising concerns for mental function decline as a side effect from urinary medications. So very recently, there have been quite a few innovations that have changed the paradigm. Surgically, transurethral resection prostate, or TURP, as you may have heard it, is the gold standard. It's a hospital-based procedure. It can be done with a laser, a green light, or a plasma, or simple old-fashioned electricity. It may just not be what many men want if the problem is not so bad. If the problem is severe and the prostate's very big, that's still the best treatment option. UroLift is one of the newer innovations. It can be done with mild sedation, and it pulls the sides of the prostate away with near immediate results. For a prostate that's a little bigger, Resume can be done in an office setting and results in actual shrinkage of the prostate using ultrasonic superheated steam. Sort of imagine like an ironing board on the cells of the prostate. Obviously, the best treatment for one man may be quite different for another. So really, you need to have a urologist you can trust and with whom you can communicate and help you choose wisely. So let's move to the 800-pound gorilla in the room, erections. Viagra and Bob Dole brought the problem to the mainstream and our living rooms. The most effective oral medication now seems to be Cialis, although Viagra works quite well. Still, it is not for everyone. Also, they've become generic, so much less expensive. If oral medications don't do the trick, there is, of course, more advanced evaluation and treatments. They involve painless penile injections. They work very well, but have a limited timeline. After a few years, they either no longer work or patients no longer want it. And as a last resort, there is surgery with implantable penile prostheses. Those can be either rods or pumps. They work great. However, there's a non-trivial infection and failure rate, but still they are considered safe and they're FDA approved. Of course, by this time, when I'm ready to recommend a prosthesis, I have fully evaluated my patients for cause. And the causes we look at are cardiovascular disease, diabetes, and of course, low testosterone. Andropause is the programmed decline in anabolic steroids, i.e. testosterone. It can be part of a disease process. Men of all ages can experience it as well. I've even seen it as a result from viral illnesses, and it has been temporary in those cases. And more recently, it's been discovered as a sequelae of the coronavirus. When it is treated, we often start with oral medications to drive endogenous testosterone production. If we go right to testosterone, we limit the chance of having the testicles recover. If oral medications fail, we can add testosterone by creams, gels, and injections. Pellets have not been very well received, but they also can be done. There are risks and side effects, so we watch the blood work very regularly and very carefully to try to minimize those problems. It is a controlled substance, and in fact, it's in the same prescription category as narcotics, and it's very tightly regulated, even though it's not related by chemistry or function to narcotics. Also, testosterone affects BPH and erectile function. So if the hormonal balance is off, the prostate grows and erections are less responsive. Fixing this balance is not a miraculous cure, but does set the stage for better function. So I think we have some time. Oh, did someone say something? Okay, so I think we have some time to talk about kidney stones. I am very involved in kidney stone treatments. I have my own stone center. We diagnose, treat, and prevent stones. In-house, we counsel people on their stones and prevention. We draw blood, order metabolic screening, we image, we can do ultrasounds in the office, and we even provide emergency analgesia for acute renal colic. Kidney stones have been here since ancient times. They used to be more prevalent actually as bladder stones, but as our diets have gained in protein and fat, the stones seem to move higher up towards the kidneys. Some free medical advice here is barbecue is bad, colas are bad, teas and coffee also cause us to increase our stone formation risk. So I tell my patients if it's dark, bitter, and delicious, it's probably going to cause kidney stones. So I'm a stone expert. I advise on prevention and use of the latest technologies and equipment to treat kidney stones. I have found that Aventura Hospital has been exquisitely supportive in my care of my patients. They have a modern endourology suite with brand new equipment and an excellent staff. I can treat almost any stone there. I have successfully done procedures there that only a handful of urologists in the country have been able to perform anywhere. All hospitals have issues, all procedures with all surgeons carry real risks. The best we can do is to train, prepare, discuss with our patients what to expect, and to perform professionally. And we do just that. And we have great results. We also have a great anesthesia team at the hospital whom I trust with my own family. So in closing comments, the American Heart Association, the American Diabetes Association, both support what's called the DASH diets. They are great for all of the conditions we just discussed. Following the DASH diet will limit the side effects of BPH. It will help prevent progressive erectile dysfunction, and it can help prevent kidney stones. So what's in the diet? Lots of water, fresh, colorful vegetables, lean meats, and complex carbohydrates. And that covers a lot of ground. And I'm sure I may have left you with some questions, so I've saved time for a question and answer. Well, if no one has any questions, I thank you for your time and I hope I was of some value to you. Bye-bye.